Good afternoon. Sadly, we are here today to confirm the first death of a resident of Tulsa County from COVID-19. This individual was a man in his 50s who passed away yesterday. Our sympathies and prayers and thoughts go out to their family. As you know, there are many privacy laws that surround these types of cases. We will not be releasing specific individual about this information about this person. What I do want to tell everybody is that we have conducted an exhaustive EPI investigation of this case. We have identified any potential contact tracings. We have notified both school systems and organizations and businesses and individuals who might have been exposed to this person. Those individuals are currently being quarantined. No one is symptomatic. No one is symptomatic in this individual's family. There is no known risk to the community at this time from the illness that this individual suffered. One thing that I think is really important to talk about is that throughout the course of our COVID-19 investigations, most of our cases were travel associated. We have been unable to find any travel association with this case. This is our first confirmed case of community exposure, so we do know now that we have community spread. It was also announced earlier today that we now have 5 positive cases in Tulsa. We still know that our very first case is recovered. Everyone else is still recovering. There's been lots of questions about testing capability. We do know that testing capability is dwindling, not only in Tulsa, not only in Oklahoma, but also in this country. We know that we have more specimens to be tested than test kits to do the testing. Requests have been put in to replenish those testing supplies. We have no idea when those test kits will come in. That's why the recommendations around social distancing and not gathering in large numbers are so important. Without the capability of vaccines and therapies, without the ability to test people who are potentially positive, it's important that everyone listen to the recommendations, listen to what Mayor Bynum has ordered here in Tulsa, and not gather. The State Public Health Lab has only a handful, and handful as close as we can come, of supplies to test individuals. They will only accept specimens for testing if the patient meets the criteria, including hospitalized individuals with symptoms, symptomatic individuals such as older adults or those with immunocompromised, or symptomatic people, including healthcare personnel. I have sent a letter to all the incorporated communities in Tulsa County recommending the closure of bars, restaurants, and other facilities where people gather. I've been in contact with most of those city leaders. I'm in the process of meeting with most of those city leaders. We strongly support Mayor Bynum's executive order closing and restricting businesses. If we're going to protect people who live in Tulsa County, we have to come together about staying apart. And we have to do it now. There's no time frame here. We're in critical mass. We have virus spreading in our community. Also, effective March 19th today, the Oklahoma State Department of Health will suspend lobby services for vital records until further notice. This includes the offices in Oklahoma City, McAlester, and Tulsa. During this time, all vital records staff will remain on site to fill an online phone and mail requests. You can obtain these records online. At this time, I'd like to introduce Mayor Bynum.
Well, thank you, Dr. Dart. First, on behalf of all the citizens of Tulsa, I just want to extend our condolences to the family of the first victim of this virus in our city. As the first verified case of community spread in Tulsa, we know that this will likely not be the last. But the loss of any human life in Tulsa is a tragedy. This is a city that values life, every life. It's a city that believes that every life is important. And our hearts are with the family of this victim today, and we hope they know that. It is also, now that we have a confirmed case of community spread in Tulsa, it's a reminder of how important it is for all of us to be vigilant. I want the citizens of Tulsa to know that you have a city government that is fully mobilized to address this on all fronts and to do everything that we can, regardless of what it takes to protect you. And so if that means regulations like we put in place earlier this week, or it means changing the way that we do business at the city, putting our business licensing program online as of today, or shuttering the dockets of our municipal courts for 30 days, which went into effect yesterday. We're going to do those things so that you can minimize contact with other people and increase your odds of not contracting this virus. This is something that all of us have a part to play in, and I think it's so important for everyone to understand why we've put these steps in place. We've put these steps in place. There's a lot of focus on, well, is it 250 people I can be around, or is it 50 people, or is it 10? There is no magic number in this. The less people you come in contact with, the better your odds are of not contracting this virus, period. There's not a given number where it's safe if you stay below that. The less people you're around, the better your odds. And we want to put the infrastructure in place as a community that can help every Tulsan minimize their exposure. That's why we took the extraordinary step that we took earlier this week to restrict restaurants, bars, and entertainment venues. That is one of the hardest decisions I'll ever have to make as a mayor, but we did it because we believe it will save lives in our community. I want to thank all of the Tulsa businesses who have complied with this order because they understand the importance of safety and of the lives of our fellow Tulsans. In the first day, we had, I think, some confusion just around when it went into effect, but I talked with Chief Franklin this morning, and on the second day of this order being placed, we had 0 complaints or reports of non-compliance with this order. I think that says so much about how we're pulling together as a community at great cost and great sacrifice to protect the lives of our fellow Tulsans. And I cannot thank all of those who are shouldering that sacrifice right now enough. Along those lines, today I'm hearing a lot of anger from people directed at some of our suburban communities. I think around some hesitation to adopt similar practices that would slow the spread of a virus, when I think there's an acknowledgement that there will not be hesitation to send residents of those communities to utilize beds and respirators in Tulsa hospitals. And I can understand that anger and frustration when we as a community are shouldering this sacrifice and doing it so that we can keep those beds and respirators available for those who need it most. And there are others who seem to hesitate on whether or not they should do it. I would say to my colleagues in our neighboring communities, I get that it's a hard choice. And it was not an easy choice here in Tulsa either. And so I don't begrudge them struggling and grappling with this decision one bit. I did too. But when you have the foremost public health advocates in our country at the Center for Disease Control, and you have the foremost public health advocates in our community at the Tulsa Health Department telling us, on one hand, that this is what we need to do to slow the spread of this virus so that we don't have overloaded hospitals and people who can't get hospital beds and people who can't get respirators because we had a spike in the number of people who need those facilities. You have that advice on one hand, and then on the other hand, you've got bumper sticker slogans and out of context quotes from founding fathers. I don't think that's a hard decision to make if you're focused on what should be the foremost responsibility for all of us, which is the public safety of our fellow Tulsans and the people that live in Northeast Oklahoma. So I remain hopeful. I have faith in my fellow public servants that they'll do the right thing. My thoughts are with them as they grapple with this decision, but I have faith that they'll do the right thing. At the same time, when we know that there's a lot of anger in Tulsa around this issue right now, and there's anger on other things, where did this virus come from? Why don't we have more tests available? Where are people eating on the weekends? Every day there's a new thing that people can get angry about on this. I would say to my fellow Tulsans, we don't have the luxury of being angry about things outside of our control. We need to focus on those things that we can control. That has been my message to my fellow Tulsans from the very beginning of this event. And for each of us, there are three big things that I ask all Tulsans to think about. One, again, we can't say this enough, minimize your contact with other people. The more you do that, the more you protect yourself, you protect your loved ones, and you reduce the odds of you spreading this virus to people that you love and care about. Number two, there are a lot of Tulsa businesses right now that are having to change their business models to adapt to this current environment. If you can afford to, please buy something from one of these local businesses every day of this event. Do they have great services, great food that you can order for takeout or delivery? Yes. But more importantly than any of that, there are great people that their dreams are wrapped up in those businesses. There are great people who work in those businesses. And if there's anything that we as individuals can be doing to help them through this time by supporting their businesses, we should. And so, again, I know that finances are uncertain and challenging at this time, but if you can afford it, there are lots of great lists out there that you can look up who has delivery and who has takeout and who have other services. I just saw today that Magic City Books is now selling books online. There are things like that that you can do to support our fellow Tulsans. And the third thing that I would ask of all my fellow Tulsans that we can, again, control is to think about what you can do to share a reminder to your neighbors and the people that you love in this community that we're in this together. That's one of the challenges of this virus, is that it isolates us. It keeps us in our homes. It keeps us out of workplaces and clubs and places where we would normally interact with the people that we care about. And that isolation can be a real challenge in its own right. If you have family members or people you care about that you know are home alone through this, call them up, talk with them. If you're so inclined, I had a fellow Tulsan yesterday suggest that we ought to put a Christmas light out in front of our house so that when people are driving around town, they see that physical reminder of that we're all in this together, and that there is a light in the dark, and that there is a reason for hope in this. My daughter and I, we went outside and we did that yesterday afternoon together as soon as we heard about it. And I've been really moved to see how many Tulsans just in the last 12 hours or so have started to do the same thing. So let's focus on the things that we can control, and if we do that, we're going to get through this together as a community. For all of the latest information that anyone needs on city services, how you can access those, what's going on with different city programs and offerings, you can go to cityoftulsa.org, and we're regularly updating that through each day with the latest information. Now I'd like to turn it over to my colleague, County Commissioner Karen Keith.
I just want to say, well said, Mayor, on all fronts, and I just greatly appreciate his leadership, along with Bruce Dart, as this continues. We at the courthouse now have our hours are exactly the same, but there's only one entrance to get in. We are open 8 to 5 through March 30th, but you can only get in one way. We are asking for only essential business be done. Many of our staff are now home working on computers. So you will go through screening if you try to come into the courthouse at this point. So we urge the public to conduct your business over the phone, email, or postal mail. And we know it's uncomfortable, it's scary, but we made this decision to protect the health, safety, and welfare of our employees, constituents, and the public at large. So these steps will help us maintain critical services. I do want to mention what's going on with the courts. Critical services are continuing, including emergency protective orders, bond dockets for release, and any other constitutionally required services mandated by law. So we are following those, but if you need help, you call 911 at this point, and they will put you in touch with those services. So if you are, cooped up at home and there are domestic violence issues, please call for help and do what you need to protect yourself. Our court clerk is asking that you do everything with www.oscn.net. And again, you can find all this information on the Tulsa County website. Many of you are trying to pay your taxes before the end of the month. Again, you can do that. There are all sorts. There's a drop box outside the courthouse, so you can leave those payments there. They will get picked up. You can also do it by mail. Look on the treasurer's website, and that you can get help there. Inspections is also functioning with a minimal amount of people at the office, but they're working from home, and if you need help from inspections, they're there. An update on our parks. All the rec centers have been closed to the public, and this includes Chandler, Bixby, LaFortune, and O'Brien, and the South County Community Center. Now, during spring break, of course, all the camps were canceled, but at the tennis center right now, all the indoor courts are closed. You can still play outdoors, and our golf courses remain open at this time, and the only food service there is takeout. You cannot eat in the areas there. So lean on the Tulsa County website to reach out to every county division if you need some work done at the county, or your elected officials, and that's just tulsacounty.org. And so county elected officials cannot force any entity to shut down. Now, that has to come from the State Health Commissioner, Gary Cox. And I think it's so important that the state and our State Health Commissioner do what needs to be done to make sure we can nip this in the bud before it grows. Because, as you know, there are a shortage of test kits, so we don't know what we don't know. So I personally am urging them to do that. I am also personally, as an elected official, I am asking that our suburban areas please pay attention to what Mayor Bynum has done. Let's be smart. Let's contain this. And just do what we can do. For our restaurant workers and others who are laid off, I'm just going to tell you, Tulsa County has some job openings. The Sheriff Department, they need detention workers, and they will provide needed training. Census workers are also needed. So you can find all those things by Googling. Also, I want to mention that covidresources.ok.gov. That is a website that has been set up as a resource for small businesses. So please take advantage of that as well. Please use common sense. Keep your family safe. I mean, this isn't easy, but it's what we have to do at this time. So your city, your county, our health department, we as you can see, are all working very closely together. We will get through this, but to get through this, it means we all have to be smart, and we've got to work together. So please stay safe.
We are not doing any interviews after this, but we will take questions now.
Dr. Dart, how behind is the data compared to where the virus actually is in the community? And I feel like a bad parent who's finding out my kid is failing math at the end of the semester by
So
the report card.
you've heard all of us say that we have a limited number of test kits. So can't answer that question because we cannot do widespread testing. The thing I want the public to know is that every time there's a case, we do an exhaustive investigation. Unless you hear from the Tulsa Health Department, you have not been exposed from any of these cases to COVID-19, and that's what the public needs to remember. We get lots of questions about who are these people, where have they been, and we are finding that information out. If we don't contact you, you are not at risk.
How many people are
It's a large number, and I really don't want to go into that, but there's many people through business. The family is not symptomatic. There's no risk in the schools, but the total number, actually, we're still gathering. So.
What about medical personnel?
None that I'm aware of, but once again, we're continued. We're trying to be very, very sensitive to this family. They have just experienced the most heartbreaking reality you can experience. We're giving the family some time. We have been in contact with all healthcare personnel, but we're still developing that as we go.
So we don't know if you already had health problems.
You know, we're not going to release that's HIPAA protected information that we're not going to release.
Do you have any information about the juveniles who've been tested? Are they in Tulsa County? How did they get it? I mentioned these kids didn't travel out of the country on their own.
Well, that's why we're specific to that. We have no test results back on juveniles. But as I said earlier, we have been unable to identify travel exposure, so our only recourse is to say that this is community acquired.
When was the victim identified as a potential patient? When was he compared to when he was tested?
A day before they were tested, it went that fast.
Is that unusual to be that quick from the test to?
You know, it all depends on the individual and their health status. So, and frankly, the newness of this virus, we're still learning new information. People are still presenting differently and experiencing different depth of sickness because of COVID-19.
Was the patient's family able to see him at the hospital?
I honestly don't know.
What city was he from?
Tulsa.
The governor hasn't issued any non-binding recommendations. Do we need to do something more that applies to everyone?
We do. As you heard from our leadership here, people, in the absence of medical response to this, we've got to ask people not to come together. It's transmitted person to person. It's transmitted in close proximity. We look at an algorithm for risk of exposure. Prolonged contact, such as places that the mayor has ordered closed, will result in greater risk of exposure. So yes.
And following up on that, Oklahoma still has no statewide uniform measure for this response. Is that undercutting the shutdowns and restrictions in Tulsa when many surrounding cities aren't yet doing that?
Well, absolutely. We have to be consistent, and everybody. You know, we all come together and respond to things the same way. We've got to be consistent so that we can ensure that everybody's protected, not just some people.
When someone, not to get too morbid, but when someone passes like this, can I do the normal funeral stuff, or do you have to hang on to the body, or do I have to wait? What happens?
Well, let me give you, and this is heartbreaking, but let me give you an example. This family is under quarantine. They can't come out of their home for the next 2 weeks. They can't conduct the funeral for the next 2 weeks. And even if they do at this juncture, the recommendation is no more than 10 people to be gathered. So I can't think of a more heartbreaking scenario than that. This is serious and this is real. People have got to start listening to what we're telling them.
Test kits. What happens when the state runs out? Do we start going back to the CDC? Why aren't we using WHO test kits?
All the test kits come from manufacturers. Manufacturers have to produce those test kits. If there's no test kits, there's no tests.
How many test kits do we have?
What about the WHO test kits?
You know, I can't really respond to that. All I can respond to is what our manufacturers here send us.
Do we have a number of test kits that are still in the state and in the area?
So the bottom line is that we have, last we heard, we have about 100 test kits and 160 tests waiting to be tested.
I had a question for Commissioner Keith, a couple of them. Sorry, I know. We have some school board elections coming up in 2 weeks. Have you been given any kind of guidance from the election board about how that's moving forward?
I believe the state called off the upcoming election, but I do need to double check that. I haven't heard that directly from Gwen, so I do need to double check that so I can text her and ask.
When you said the National Guard is here if needed earlier, what does that mean?
Well, I mean, you know, during the flooding, all of you, that they were here and they were absolutely vital to our success in keeping the levee intact. So they're here in case we need them. And, you know, I can see it in particular with our homeless population where we might need to call them in to help. But just the idea that they are here is of great comfort to me and probably the other elected officials as well.
Have they been, we got a couple of calls, have they've been looking at Expo Square as kind of like a mass triage.
Oh, yes, absolutely. Expo they've already got things set up out there in case we need it. It's just a perfect place when you've got a lot of equipment coming in and big trucks and individuals coming in. So Expo is uniquely, it's ready to go. So Mark has been very proactive. He's our CEO out there. I mean, they literally are ready to go if we need them.
I guess this would be for both the county and for the mayor's office. Are local officials here prepared to hand out much tighter restrictions without waiting for the state or federal go-ahead?
Well, I am asking that everybody do that. I can't force anybody's hand, but if they want to be smart, then I think our other suburban entities need to follow suit with the city of Tulsa. And I am also asking that Gary Cox, he's a state health commissioner, he is the one who can single-handedly shut all this down. So I am asking Gary to take a closer look at this and try to bring some consistency on this issue.
And I would say, as I've said all along on this, we're taking this hour by hour throughout the day. And so we'll evaluate everything as it comes, and we will listen to the best medical and public health guidance that we can receive. One thing I forgot to mention earlier that I think is important, and it's easy to overlook the other things that we're focused on, but we've been in a flash flood situation for the last day or so, and I really want to thank our team at the City of Tulsa for being out to make sure that our stormwater system was working throughout the night so that citizens of Tulsa didn't have to worry about that. Citizens of Tulsa spent decades investing in a world-class stormwater system, and so far we're not seeing any significant flooding in the community in spite of the heavy rains that we've been receiving and the really high, historically high soil saturation rate that we have.
What are we doing for our first responders on personal protective equipment and how they're going to be handling when they have to transport or meet the public on the front lines?
So I will say that personal protective equipment is a challenge across all areas that I'm hearing from right now for our first responders, for even in the medical profession. That's something that I know Tulsa Area Emergency Management has been working hard at a national level, trying to get an allocation of personal protective equipment. For our first responders, and I spoke this morning with Chief Driscoll in the fire department, I mean, they believe that they have what they need for the short term. The greater concern is over the long term, depending on how long this event lasts, whether or not we have both for Tulsa Fire, Tulsa Police, and IMSA enough to last over a prolonged duration where they're having to use it at a greater rate than we normally would be. But also say that the Tulsa Health Department has been absolutely fantastic at working with our first responders at the City of Tulsa. Anytime that there's identification of an individual who one of our first responders might have come in contact with that has tested positive or is even suspected and is under observation, they've immediately notified us at the City of Tulsa, and we've put those first responders into quarantine. I'm very thankful. I mentioned earlier in the week that we had 3 city employees who were isolated and under observation. All of them have tested negative since then, but we'll continue with everything on this to monitor it day by day.
What does the algorithm say about how many cases are really out there
That
compared
would
to just
be
the positive tests, like 2 times, 10 times, 10 times? Okay.
I'm sorry, I didn't hear your question.
No, that's okay. What does the algorithm say about how many cases are really out there compared to just positive tests? Is it 2 times, 10 times?
You know, we have no algorithm because we're not testing. What I can tell you, and this is why social distancing is so important, we do have social distancing charts. One person who is left to gather and to go within the community in 30 days can infect or expose or infect up to 406 people.
Gary, one last question. Hey, doctor, is there anything people can do in the meantime? I've heard some on some news shows about chloroquine, hydrochloroquine. Is there anything out there that people can be taking advantage of?
You know, I do know that they are testing and looking at different therapies and looking at other remedies, whether it be natural or clinical. So I think at this juncture, it's important to look at all possibilities. We are going to find some very, very specific therapies, whether it be herbal or natural or clinical, that will help respond to this virus. Thank you.